Governor Perry, one of the things I believe you say in your book, and forgive me for not having read it yet, is that you think perhaps dropping out of Medicaid, a state dropping out of Medicaid, and you have even talked about dropping out of the Children's Health Insurance Program, otherwise known as CHIPS. You've got, by the last time I looked, about 3.6 million children disabled or poor in Texas who would then lose their health benefits. What happens to them if you opt out of Medicaid?
What we think works very well, and I totally agree with what Tim was talking about from the standpoint of those bureaucrats who are shooting these huge numbers forward. But let me back to the issue at hand. We would create our own insurance program for them. And I've had a waiver request for 4 years.
The government gives you 60% of the money to fund this. How does that add up to help you?
We understand that's our money. And you talked about us taking stimulus dollars. We send hundreds of billions of dollars to Washington, D.C., and generally don't get very much of it back. We'd just as soon not send as much money to Washington, D.C. Let us in the states come up with the ideas. I can promise you, Palente and Jindal and Barber and some Democrat governors across this country as well will come up with really good ideas about how to deliver health care. Why not let us pick and choose rather than this one-size-fits-all mentality that comes out of Washington, D.C. with strings attached? I've had a waiver for 4 years in front of Department of Health and Human Services and haven't gotten an answer yet to free us from the strings from Washington, D.C. That is the issue at hand. Let the states be the laboratories of innovation, and the good ideas will come out of that. And I can promise you, Palente and I will go snitch from each other and put them in place in our states.